Good afternoon. Ladies and gentlemen, there is one saying in medicine, and this saying does stand very firm, and that is worms can mimic anything except pregnancy. That means the worms can mimic anything except pregnancy. Now you'll ask me how? How can the worms mimic any other disease other than pregnancy? Now I am going to elaborate on it. If it goes to the brain, it causes meningitis. Comes to the sinus, it causes sinusitis. Comes to the nose, it causes rhinitis. Goes to the throat, it can cause laryngitis. It goes into the lungs, it can cause pneumonitis. If it is close to the pharynx, it can cause pharyngitis. Goes to the esophagus, it causes esophagitis. Comes to the stomach, it can cause gastritis. Goes into the liver, it can cause hepatitis. It goes into the diverticulum, it causes diverticulitis. Goes into the appendix, it causes appendicitis. Goes into the colon, it causes colitis. And comes out and lays its eggs around the anus, it causes pleuritis. My God, what a big list, isn't it? These worms have got countrywide operation in the body. They move everywhere. They can go anywhere because it is seen when the child sleeps, the worms have come out of the nose, looked around what is around, and gone inside again. So all this thing is caused by the round worms, or what we call in Marathi we call it jantasa vikar, janta, roundworms, and they cause a host of problems in homeopathy, not in medicine, and except pregnancy, in case they go into the vagina and well, they cannot cause pregnancy, but they can mimic anything. If they penetrate into the peritoneum, they can cause peritonitis. Because if there is an ulcer, they can penetrate to the ulcer and there can be a septicemia in the stomach. So many problems can be caused by worms. And of course, they are sitting there in the stomach to have their first most nutritious share of your food. As soon as the child eats the food, the first पहला हक्क, इनका पहला हक्क रहता है. The worms, they eat the most nutritious part, and राहिलेला सगळा चोथा, which is having no nutritious value, is given to the body. That's why it says that the child is eating well, but because of the worm infestation, is not putting on weight, is anemic. So there's host of names which are put in. मुलग्याचं वजन वाढत नाही, मुलग्याचं रक्त कमी आहे. All these things where the blood, I mean, hemoglobin is also low because all the nutrition is taken over by the worms. And if they breed too much, they can cause intestinal obstruction. I have seen, because my father was a surgeon, one surgery where after this, when the X-ray was done, there were a lot of opacities in the X-ray. So my father said it is full of worms, and by only giving deworming, the patient is not going to get relieved because the worms, if they die there, they can cause septicemia. They can cause septic. Because the olden days, the worms, whatever the deworming medicine was, that was to kill the worms. Whereas today, the worms, they get paralyzed and they pass through the stools. But in the olden days, that was the main, they used to kill the worms. And any death tissue inside the gut can cause septicemia, and the child can go into, or the man can go into convulsions. So my father had to do a surgery and remove the worms, and I've seen it was almost one 1 liter full of uh, uh, Barney, what we call it, one full liter, liter of Barney, 1 liter full of jar. It was filled with worms, only worms, round worms. So imagine in India, the biggest problem for malnutrition is worms. In India, it is the biggest problem. And we keep on giving them tonics, we can keep on giving them different supplements, and still the child doesn't put on weight. But a deworming done, because the children, they tend to eat each other dabba. They tend to eat each other dabba whenever they are in the primary school or in the nursery school. They feel like putting their hand in someone else's dabba. उनका जो टिफिन बॉक्स होता है इसमें हाथ डाल के खाने का आदत रहता है. And here the worm infestation can take place, and the child becomes remains thin, lean and thin. So here the main causative factor in Cina is worms, and in Chamomilla it is dentition. So now yesterday some smart homeopath asked me this question: how do you differentiate between Cina and Chamomilla? And then now today I have the answer for it, because see, the both have got different causative factors. Cina is because of worm infestation. If you palpate, if you palpate the abdomen, you can feel the knots in the abdomen. It they can be because of worms, and the child, though eating well, I am repeating it, though eating well, is not putting on weight, is anemic. And another thing is ravenous. Ravenous is nothing to do with Ravi. It is ravenous hunger, where as soon as he eats, he again feels hungry, because whatever he has eaten is taken over by the worms. The body is not getting it, and there's a great desire for sweet. Whenever a child starts eating sweet, our old ladies, the granny's formula, this is a janta salet, and give the child some and deworm him, because it's sarko god khaya lagla hai, that is deworming. So here, what I'm telling you is, this is one of the main causative factors in India, not only for children, even for adults, and even for cattle. म्हशी आणि गायींमध्ये सुद्धा worm infestation is in cattle, that is uh, the cows and the uh, buffaloes also can have worm infestation. And then we can still think, even in cattle, even in one cow, I treated with worm infestation, because she had recurrent worm infestation, and I treated her with Cina, and she passed an enormous amount of stools. She started having loose motions, and with the loose motions, she passed an enormous amount of worms also. And after that, she never had it, because they said that though they were feeding her with good food, she was not putting on weight, and she used to be very irritable. Now, the irritability in the children in Cina is very similar, exactly a photocopy of Chamomilla. The Chamomilla also is very uncivil, demands for a lot of things, throws away those things, keeps on extremely irritable, wants to be carried. Chamomilla is better by carrying, whereas in Cina is not relieved by carrying. Now here again another differentiating feature, because both have got same mental picture. There is no difference at all. Sometimes there's only one another mental picture, where they say the child becomes irritated just by looking at it. That is extreme. Now child does not like to be caressed. You just have put your hand on his face or the head. He doesn't like to be touched. Both Cina and Chamomilla. Whereas in anti-improved, you just look at the child, and the child starts howling. Even he cannot tolerate to be looked at. So that is so irritable. The anti-improved child is more irritable, I think, than Cina and Chamomilla. Both of them are very cranky. Chamomilla and Cina both keep on crying, whereas Chamomilla is better by caring. Cina is not better by caring. So there is another modality which is differentiating Cina and chamomilla. Now, because there's no nutrition to the body is lack of nutrition. The worms are the first हकदार of whatever you eat. जो कुछ आप खा रहे हैं उसके हकदार worms है. They are the first people. They are the first force which is taking away all the top nutrition whatever you eat, and then naturally there will be dark circles around the eyes. You feel like as if there's wearing a sunglasses, dark circles around the eyes because of course because the pelar he doesn't have enough to eat, his nutrition is not there, and his face are pale and cold, face is pale and cold, drawn, and then cannot sleep because of the worm infestation, always feels hungry. कितना भी खाने को दो उसको, again after some time or immediately after food also, he may demand for food, and because of worm infestation, as I told you, right from convulsions, right from convulsions to fever, all symptoms can be present, but irritability and the causative factor is the main differentiating feature during in chamomilla and Cina. Both, as I told you, both are extremely unsocial, extremely uncivil, extremely irritable, extremely keep on demanding for things, keep on throwing away those things. Both are unsocial, uncivil, but still, if you see in both have got certain differentiating features. The main feature is, I'm repeating it, the main feature is a causative factor. We have to go into the causative factor. Is it dentition or is it worm infestation? That is the main feature. And second is, he feels better by, in chamomilla, he feels better by carrying. Whereas Cina, they say it is better by rocking. Rocking बोले तो उसको झुलाना पड़ेगा, जोर जोर से झुलाना पड़ेगा to just take away his attention from his problem. So that is not a permanent solution, of course, but they say it is better by rocking, and because अगर उसको बच्चों को जोर जोर से झुलाएंगे, झूले में डाल के झुलाएंगे, तो for temporary his mind is taken away from his basic problem, and slightly he is entertained with someone else. He is entertained somewhere else. उसका मैं मन थोडंसं बाजूला थोड्या बाजूला बाजूला जाईल तेवढ्यापुरतं, but that is not a permanent solution. So here you have then another thing, as I told you, the worms can come out of the nose. Yes, there are instances people have taken photographs where the worms have come out of the nose, they come out, they lay their eggs around the nose and again go back. Now in small children like infants, they cannot put their they cannot bore their nose because they don't know how to bore the nose, or they don't have that technical expertise to bore their nose. So normally Cina always keeps on boring the nose. पुराना जो फोन होता था, डायल वाला फोन, and then direct STD, continuous STD is going on, STD phones, long number, so he keeps on boring the nose, or in his infant, he rubs the nose on the pillow or rubs the nose on the shoulder of the nurse. Nurse bole to not exactly a medical nurse, the lady who is looking after him. So when you are carrying the child, and the child will keep on rubbing the nose on the shoulder of the nurse, that means the person who is looking after nursing the child, nursing the child. So here you keeps on boring the nose, and the face is always pale, and they say it is red and hot and cold. And it is more in chamomilla, not in Cina. Cina, because there is no nutrition at all. The proper nutrition, the most important ingredient of what your body needs, is taken away by the worms, and they can multiply very fast. And here we have a remedy which can give you a greater access, because in India we have a huge population infested by worms, because we have a big jhopatpatti also, and here we can do wonders because this takes away a tendency. Deworming tablets in the modern medicine, they will deworm the child, but that does not bring down a tendency. अपने body को भी tendency होनी चाहिए कि just there should not be any worm infestation. So that's why we think of Cina. And then I'm opening up the windows because it's a small remedy, but again an important remedy. It is here where most important for the malnutrition in the children, and we think that by giving supplements or by giving tonics and make healthy food, the child is going to improve. No, remove the causative factor and you'll get the result. Right? Thank you. Any question? Any question?
Sir, many times mothers complain that child eats very well, but uh, he's not gaining weight, and uh, like, so should we give Cina to them?
No, see, now if you have a causative factor, Dr. Mugda, if you have a causative factor like worms, if the child is rubbing his nose or always boring the nose, and then if he is scratching his anus, because the worms come out of the anus also, and when they come out of the anus, it causes pruritus. So if they keep on scratching the anus or the nose, then we can think of Cina. But if he's eating well and not putting on weight, then we should think of calcareous.
Okay, sir. Yeah. Mhm.
Hello.
Yes. Yes, ma'am.
Hello, sir. Yeah,
Hello, hello.
many patients complain. I'm Dr. Sonal here.
Okay, fine. I'm
Yes,
hearing
sir.
you.
Many patients complain. Yes, many patients complain. Kids they grind their teeth even in the night, but
Yeah,
there
that's
is
right.
no
I
worm
forgot.
infestation.
I forgot. I forgot. But that was one of the symptoms. See, I may forget because I don't carry a paper with me when I teach. I'm sorry, very sorry. They have grinding of the teeth, grinding of the teeth during sleep. They grind their teeth during sleep. One more symptom in our friend Cina, and another thing is squint. They develop early squint. Squint बोले तो convergent or divergent. आके in Marathi we call it टर्क. टर्क बघते. So sapna or टर्क, whatever it is. So here you have a squint, develop a squint, and grinding of the teeth is again another two important features which are really overlooked while teaching you Cina. And yes, we can take it forward.
काय ना म्हणजे ते पॅरासिटामॉल खायला होत्या
Kyler,
ते गोळ्या चालत त्यामुळे विकण्यात आलेलं
विनायक चौधरी काय हो काय पाहिजे hello, any more questions? Yes, please.
Yes, sir.
Yes, Ulka, you have some questions? So Sonal, any questions?
No, sir. No question today.
No question today. Why?
Sir, yeah, Cina is very nice remedy. So no more questions.
Sir, one more question.
Yes.
Sir, in the case of worms in children, apart from Cina, which other remedies you have used in your practice?
One called cucrium, where there is no threadworms. Cucrium.
Okay.
Cucrium for threadworms. And then, well, these two remedies, and there's one more, which is an odd remedy anyway. But cucrium and Cina have done wonders. They,
Yeah, Cina always give wonders. For worms, Cina works for adults and children both the way.
both, yes. That's right.
Thank you, sir. Thank you.
Thank you, sir.
Cina is
Sir?
Dr. Sonal.
Yes, sir.
Dr. Sonal, is Cina a wonderful remedy, or the knowledge of Cina is wonderful?
So both the way. Both the way.
Sir, I also wanted to ask, Cina, as I was asking you, grinding of teeth, but grinding of teeth, only Cina should be thought of, or other remedies are also there?
Belladonna is there, grinding of teeth. Cicuta is there. Cicuta is there, belladonna is there, Cina is there. Then
What is the reason for grinding in cicuta?
Cicuta is because of head injury.
Okay. And belladonna also because of congestion?
The belladonna is because of congestion, and noctumica is because of anger.
Okay. Yes, sir, because why I asked you this question, because there are parents, when we take, the child is a very angry child and there is grinding of teeth in the night. So that means we should think of Nux vomica also in this,
Laxomika,
because
you
even
can think,
Cina is irritable, but there
right,
are no worm complaints.
fine. Well, you can think of Laxomika, you can think of Chamomila, because Chamomila is full of anger, cannot tolerate.
Right.
Little,
So Nux vomica next, um, so very angry child should be like chamomile, Cina.
you can think of the, see, Cina has to have a positive factor. Without positive factor, normally no one uses Cina.
Okay, that means a worm is the entry point.
That's right, 100%.
Hmm. Okay, sir.
Thank you, sir.
Thank you, sir.
You want to get rid of me now?
No, no,
Sir,
sir.
sir, sir,
Hello, sir.
sir, 1 minute, sir.
Uh,
Hello, sir.
Dr.
Sir,
Sushila.
Dr. Sushila here. Yeah, sir. One patient also is there from my side. So, मतलब child is not want to anything eat. Only drink to milk. So
Yeah.
what to do, sir?
It doesn't want to
Nothing,
eat.
not want to eat anything.
Now you please find out if there is a problem while swallowing. Try to find out the problem while swallowing, because there are a lot of children, because of the indurated tonsils, they cannot have solid food. The tonsils, they become indurated, they remain large. Though there is no pain in the throat, the tonsils remain large. And now we go to the Barata group, where the indurated tonsils are there. They can swallow liquids, but they cannot swallow solids.
Huh? Yeah. Okay.
We can think of Barata
Hello,
group.
sir.
Yes.
Hello.
Dr.
So
Pawan.
in the book it is written spigelia for pinworm. So sir, I read that, but I think
What do you want to say? I'm not understanding.
spigelia for the pinworm.
Yes,
Hello.
Spigella is also for worms. Yes, you're right. You're right. Spigella is also for worms. Right, ma'am?
Hmm.
Okay. Thank you.
Thank you, sir.
Thank you, sir.
Shall we end the lecture?
Yeah.
Okay.
Enough of Dr. Ravi Yadav.
No, sir, it's not like that.